we're going to go ahead and measure the respirations. You don't really need to touch the patient. All you have to do is just look at their chest, see if it's going up and down. Okay. So Ms. Smith, I'm going to go ahead and take your respirations. I already did my opening. I don't need any supplies. So I'm going to go ahead and take your respirations. Okay. One chest rise and one chest going down is one respiration. Okay, so in, out, that's one, and in, out, that's two respirations. Okay, so we're going to go ahead and look at the clock, pick a starting point, and make sure you say start out loud. Start. Go ahead and count her respirations. So breathing in, breathing out, that's one. Breathing in, breathing out, two. Breathing in, breathing out, three, and so forth. Make sure you count for a whole 60 seconds or 1 minute. Once the 60 seconds is up, make sure you say stop out loud. That will indicate the evaluator to stop counting. Okay? So stop. All right, Ms. Smith, you're all set. Go ahead and do your closing procedure. Wash your hands. When you step outside the room, you're going to have this paper where you're going to chart or record how many respirations you got.